Let's say that you're at home watching a Warriors game on TV, and there's a Palm Beach area code that comes up on your phone, and you answer it, it's the president. And I'm not going to imitate him. I'm not even going to try. But he says, you know what, you guys are doing pretty well at this. Your rates are lower than pretty much every others in terms of rate increases for ACA. I want you to be our new healthcare czar. What's your plan? What would you tell him?
Well, first of all, I would say I'm having such a wonderful time at Kaiser Permanente that
this is a hypothetical. So roll with me a little. You'd say wait till halftime? Is that what you'd
exactly.
say?
I believe that I can contribute more by at least opening the doors of Kaiser Permanente to serve as a case study for the country.
So if there are one or two things on a street level, a ground level, given all of the political winds going on right now, keeping your objective in mind, what would be your advice?
My advice would be to step back and ask the bigger questions that you want to get resolved. The first one being, who's going to assume the risk for the cost of care for the American people? And right now that's distributed all over the place, and in some cases it's unclear, right? I would ask that question. And when you hear things like pre-existing condition, which by the way is a term that I don't use, people have conditions, and when you think about pre-existing condition, you're in the insurance mindset. Mm-hmm. When you think about conditions, people come into our system every day with conditions, so I would avoid that. But I would ask, who's going to deal with dealing with the risk associated with people when they get sick, and then how to deal with that over time.
Right.
I would ask that question. The second one is, what do we need to put in place to incent and to drive the delivery of care reform in the 21st century? That's the fundamental issue from my view.